Hey, Don.
Hey, Mike, how are you?
I am tremendous.
Tremendous. Another big word.
Tremendous, 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 tremendous.
In a world where most podcasts sound the same, two guys talking about almost everything under the sun. Ladies and gentlemen, here is And Stuff with Don and Mike.
Really?
Come on! 5, 4, 3, 2, 1, 0.
Hey, everybody. So this is Don,
This is Mike.
and we have a special guest today, and we're really looking forward to talking to him. His name is Roger, and he is a male nurse. And I've known this guy for many years. Very nice guy, very informative and very knowledgeable. And so we asked him to come on to talk to all of our listeners and our future listeners about a few medical issues that people in our age group may or may not get, but we still want to
know as much as we can about
prepare.
Prepare is right.
So without further ado, I'd like to introduce to you Roger.
Thanks, Don and Mike. Thanks for having me here. Again, my name is Roger, and I'm a nurse. I've been a nurse for about some 20-something years. So it's been a long time. And currently, I'm a hospice nurse. But I started out as a regular nurse on the floor for about 2 or 3 years at the Henry Mayo in Valencia.
I love
Spent
it.
two and a half years there. And then from then on, the rest of the many years of my experience are in home health. And recently I changed into being a hospice nurse. So that's what my background is. But before we get started, I just want to make sure that I'm not giving you guys any medical advice. And this is just a friendly conversation and, sharing you my experience.
Always consult with your doctor.
Yes.
Yes.
Yeah, always consult with your doctor. But it never hurts to have a friendly guy wearing a jumpsuit give you some tips.
Yeah. And we are not, if he says something that we don't believe in, we're not going to say anything anyways, but
That's right.
We don't, we're not in the medical field either.
No.
So,
And
so
by the way, thank you.
yes, thanks for coming.
Thanks for coming, but thanks for
My
being
pleasure.
You were well needed the last couple
Heck
of years.
yeah.
So
Heck yeah.
keep up the good work.
So, Roger, you've had an ailment that was treated. Can you tell us a little bit about it?
Yes. I was 46 years old when I was diagnosed with prostate cancer.
Wow.
So basically, I was one of the youngest during that time in a very rare situation to have prostate cancer. Usually, prostate cancer patients, they start from the range of 50 on.
Yeah.
And for the age of 46, I'm one of the youngest ones, unfortunately.
Wow.
And so it was very shocking. My son was only, he was about 15 or 16 years old. So when I got the message from my doctor, actually I was at a patient's home when he called me, because I gave him my cell phone. And because it rang, I suddenly picked it up, and it was my doctor. And he goes, "Hey, Roger, I just got the result, and yes, you have prostate cancer." And I was right in front of the patient.
Wow.
So it was a really bad timing.
So,
So my patient told me, why don't you sit down? So I became a patient at that time. Sit down and just calm down right now. And
So what are the, how did you get to, I mean, what made you go to the doctor? Was it a routine thing? Did you have some type of symptom that you were dealing with that,
no,
that-
yeah, I mean, yes. I being a nurse, I also hated going to the doctor.
Mhm.
I'm a Mr. Know-how. I'm okay. I have no medical problem. It's you that have a medical problem, not me. So that's how I looked at it. So anyway, one time I was driving and I felt like I gotta go pee. I was driving and I go, I don't know where the bathroom is. I don't know where any near McDonald's is or anything like that. So that was the first time. And then after a few times, I'm sorry about that.
Okay.
Let me turn it off.
Oh, we didn't hear anything, so.
Oh, you didn't hear anything?
No,
Okay.
it's probably your broker saying sell.
So anyway, it got worse. So being out on the field, I would have that urge, but now it came to a point like I only got about a few seconds before I urinate.
Wow.
So it's like immediate.
Let me ask you, was it full, like a full bladder, or was it just like dribbles?
During that time, it's I gotta go. It's
When you
full.
finally went, was it a lot or a little?
Yes.
A lot, really.
Yeah, it's full. I was not dripping or dribbling, nothing like that.
So you had to go.
But no pain, huh?
Yeah.
Other than the discomfort of peeing.
No,
Wow.
basically, it's just abnormal. A normal person will not have that urge and had to go to, you got just a few seconds or you pee in your pants.
Oh, wow.
Yeah.
So then, I went to the doctor, had my test for prostate, which is PSA.
Mhm. That's the blood.
And that led the way to a urologist. So back then I was with Kaiser.
Mhm.
So I went to a Kaiser doctor, very good young doctor, graduated from UCLA, been to Europe and had this really good training. So what the procedure was to get a biopsy of my prostate. So during that time, it was a big probe that you had to insert in your rectum and kind of clip a tissue of your prostate. So the first biopsy, he couldn't make a decision whether I had it or not for some reason. I think there were small samples of biopsy and it's vague. He took quite a few of those and he couldn't tell. So I had to do it again.
So they brought you back to another trip to the salad bar.
Yeah, and we had to do the same thing again. It's very uncomfortable
I can imagine.
to get it done.
If you didn't do it, you'd be in trouble. You might not be sitting.
I had no choice. I had, he won't do anything else. He had to know. So we won't be able to find out the next option.
No, wow.
So anyway, we did the second one. And on the second one, that's when he called me and told me it's positive.
Wow.
You got prostate cancer and come into the office and, we'll discuss about it.
I'm sorry. Is this something that's been in your family? Does anybody else
Nope.
in your family have prostate cancer?
Yeah, is it hereditary?
Nope.
It's
I
just,
was the only one.
just
I was wondering
Just
why.
a lucky
My
one.
family have no history of cancer that I know of at all.
Wow.
So anyway, when we got to the office, he gave me the options. Either I take medications or a radiation treatment, radiation that I
Seed
think
that they
he
put in there?
offered some pills,
Okay.
and those are radiation seeds that will go into my prostate. And it's non-selective. It will kill anything it's on its way.
Oh, wow.
It will kill regular cells that are healthy, including anything that it touches.
Wow.
Now, the second option is surgery and get the whole thing out. I did not hesitate. My wife was there with me. So I did not hesitate. Get it out. I said, get it out. I don't care. But he said, but you know what? The danger of having a radical prostatectomy, which is taking out the whole thing, is there's a chance of you being incontinent.
Yeah,
You won't be in control of your urination. That there is a chance of that.
So how did you balance?
So
How did you balance?
I still didn't care.
You just
I
wanted
didn't
to
care because it's like life or death. You know, I could just wear diaper or whatever. I don't care. Pee in my pants, whatever. That's okay.
Diapers nowadays.
Yeah.
Yeah. So
Yeah.
at that time, I don't know how good. I'm sure they have improved in their techniques, and you know, all this robotics and everything, and the medications that they take and all that. But during that time, that was the two options that I have. But my decision was immediate. And the positive thing that he told me was prostate cancer is a very slow cancer.
Yeah, it is.
So he told me, hey, take a vacation. You know, take a vacation. And I told my brother, who was alive at that time, was a doctor. Also, yeah, you know, travel first. So I went to Canada and see some relatives there and tried to get my mind off of it.
And also just in case you just get all those bucket list things done, not that you're going to perish,
right?
But just in case you are kind of stuck to incontinence or whatever, right?
Exactly. And I don't really know if I'm going to survive it, whatever. You know, you'll never know with surgery. It's a total anesthesia, general anesthesia and all that. You really don't know. You really don't know. It's a very scary thought at 46. And so I was crying, you know, because not because of me, but I have a 16-year-old kid.
Oh.
And my wife was too young. So, you know, I would go to different churches and just bow down and pray and go to, and I wasn't ashamed, and I told everybody what my situation was. And so a lot of people were supportive, family and everything. While before I had the surgery, I tried to get really fit. So I was eating healthy foods. I did some running. So I was really strong prior to the surgery, as far as I can remember. It's been a while. Yeah. So I'm at a good weight and I was ready. But I can tell that my wife, Christina, she's scared. And, you know, prior to the surgery, when I was wearing the gown, she put a tiny medal of Jesus, baby Jesus angel here. And, you know, I was being prepped and all that. And when I got surgery, oh my God, the panel of people there, it's like, during that time, there's, as far as I can remember, it's like 7 people there, like, oh my God, you know, I'm like, scared the heck out of me. But, you know, the doctors, nurses and everything, they're so nice. It made you relax, they joke around, and suddenly they just told me, okay, just count from 10 to 1. And I barely, it says, boom, I'm out. I was out.
So the bottom line is, and I don't mean to rush you along, but because it's a very compelling situation that happened, but like, other than the sudden urge to go, what other symptoms should our listeners look, should they say, oh, maybe I should have myself checked? What kind of other, or is that basically it? Was there pain involved? Was there?
No, it's just that being a nurse, I knew that I'm in a lot of deep trouble.
Right.
Yeah.
I can tell that, no, that is not normal, that my wife doesn't have to pull me to the doctor's office. No, I am going to the doctor right now.
Okay, here's a question that I've been asked, and I ask other people. Are you one of those typical guys that something's wrong and you wait a couple days to we'll see if it disappears? Are you one of those guys that say, wife, I've got this issue, what do you think I should do? Or you just, bam, you just go right to the doctor? Because there's a lot of different people out there.
Yeah, I understand that. Mostly men do that. Like if they're in pain or it's nothing, symptoms you try to ignore because, either you're embarrassed or anything like that. Sometimes I do that.
Yeah, but I admire the fact that you didn't, and that you were honest with your wife and friends, and you saw the support. It was very important, especially at our age, because I do the same thing. If I have like a pain or something, I'll get over it eventually.
Exactly. And sometimes it's good to do that because maybe it's really nothing.
Yeah.
And one thing typical with nurses though is the other way. We're very hypochondria.
Oh yeah.
So one symptom, it could, or maybe I have cancer, or maybe I have pneumonia because I'm coughing, or maybe I sneezed and maybe it's a lung problem or something like that.
Oh yeah.
So
I saw that with my mom. My mom was in for Cedars for like 40 years. And she'd do that. She'd come home every time there was a new wave of something. I think I may have the swine flu, or I think I may, every time something new came, she'd have she'd have it. And oh my God, everyone would have to take precautions, cover your mouth.
Exactly.
So
you can be very paranoid.
So how long
that's
have
very
you been
typical of
free
nurses.
of this disease?
Oh yeah.
I'm sorry?
How long have you been free of this ailment?
I was 46 and I'm 63 now.
Oh, okay. Very cool. 17 years.
Yeah.
That's great.
So thank God, after 5 years of being followed up by the doctor, he said, you're free. I don't need to see you. If you die, you'll probably die of something else.
Congratulations.
That's good news.
Yeah.
And I like the fact you got it out of the way early.
Yeah.
You just got it out of the way early so you can enjoy your golden years without having to worry about colon or prostate cancer.
That's a very important thing, Mike, because a lot of times, especially with prostate cancer, the biggest mistake that you will ever do is ignore it.
Right.
Because once it gets worse, the way it travels is it travels to your back, to your spine.
Oh,
and that's a freeway to everywhere.
And and you will have this extreme back pain, and sometimes you might think, oh, maybe I just pulled something. But that extreme back pain could be the cancer has already spread, and it might be too late.
Boy.
When it gets to, because you can get to the lymph nodes, you can get to everything from the spine. It's blood, marrow, everything. It's over when you do that. I know for my dad died of lung cancer when it spread to his lungs. I went to his spine, and once it got to his spine, it was done.
Yeah.
Can
Yeah.
you,
And it's a very painful pathway, man,
wow.
because of the bone.
So can you, I mean, and I don't want to get it too personal, Roger, but I mean, so you went through this and everything appears to be fine. Can you resume your normal duties as a husband? Can you, are there any restrictions? Do you have to worry about what you eat? Anything like that? You can't drink too much water?
No lechon.
Right. You know what? My sexual function is gone.
Oh, okay.
But when I was recovering, because I was still young, at 46. So the doctor said, yeah, you might have a problem with erectile dysfunction and all these things. But the good news is there's Viagra. There's
So that works.
So yeah, if I want to, I don't want to. I chose not to.
Life is so much easier.
So
It's so much simpler.
yeah. So my functioning sexually was okay for about maybe a year, and it started dying down. So I just let it be.
Yeah, that's important.
And I'm okay with it.
That's a big question to a lot of people be asking, you know, because that's a big worry on a lot of men, especially, you know, our age, 46
Yeah.
at that time, you're not too far away.
But then I don't care. I didn't really care, because the way I see it, I had a second lease on life.
Yep.
Yeah.
That's
What
more.
the hell is a sexual activity anyway? It's
Yeah.
such a small percentage of your life.
It is.
You know, it only takes
Good for
5
yourself,
seconds,
man.
right?
I'll cross that bridge.
Yeah.
when I come to it.
I'm just kidding. I'm just kidding. No, it's a pretty serious subject, and you know, sometimes I personally, when things like that, like I went through some health issues and stuff, nothing like that. I couldn't even hold a candle to that. But you know, when you're kind of afraid, you make jokes, so it lightens it up a little bit, because you never know. You know what I mean?
Mhm.
It's nice to hear it though from
Yes.
you, because it does kind of help you relax, and everyone's going to have different reactions.
And you're a nurse,
And
so
you're a nurse.
you know both sides of the spectrum. You know,
Yeah,
you
you
know,
understand.
you understood. See, like when I went in for surgery at one point, you know, my wife is a nurse, but she knew all the book stuff and all that stuff, but I knew nothing. So
All right.
it was scary for me, because it was like, okay, so they're gonna open up my chest and they're gonna do this and they're gonna do that, and I don't know if they're gonna play ping pong in there or whatever, you know. But
Right.
she would tell me everything that was gonna go on, but it's still scary. So you were on the nurse side because you knew, and you're also on the patient side, so you probably were more prepared than most people.
Yes. It doesn't take away the terrifying feeling
Oh, of course not.
of not knowing what's on the other side.
Right.
So the recovery phase is scary too.
Yeah, how long did it
That's
take?
a lot of pain.
Really?
I had a lot of pain in my, I'm sorry.
I said, really? I was agreeing with you. Where do they, when they do the procedure, they go in through the rectum, or do they go in anywhere else?
No, they during that time, I know there's robotics now, very little incision, but during that time, right below your belly button.
All right.
So they just made like about 3 or 4 inches of a cut, and that's where they go in.
Yeah, that's a bad spot to cut in, because any woman with a cesarean will tell
Yeah.
you.
Or
that
a
is.
tummy tuck.
Yeah, I will tell you. I'll
Yeah.
tell you that is. You can't move. It hurts, I imagine.
Yeah. But here's my opinion about that. I don't know if they're still doing that right now. The good thing about cutting instead of robotics is, I think from the surgeon's point of view, is when you cut, you can actually see the prostate. You can actually see what you're working on. But with robotics, you got these probes just sticking in there, and you're looking at maybe the camera, I would think, and you're not really seeing the whole thing.
Yeah.
You know, I don't know if that's a factor now, or
I think
you know,
they
it's
do 3 holes. Isn't that like most invasive surgery?
yeah, a
They're
few
like 3
holes there,
They-
and that's it.
yeah, they just go
It's
in. They better have
yeah.
a high def TV. 'Cause-
Yeah. So now you're like a bowling ball.
Yeah, you think they have 4K TV when they're doing that? I want high def
Mhm.
on mine.
I'm sure they're very advanced now and things like that.
I hope so.
So, well, thank you for that. I really appreciate we all do.
And your honesty, yeah.
Yes,
that's-
absolutely.
You know, a lot of people, like I said earlier, will not admit to it. They think it's a weakness, but if you don't talk about it, no one knows about it.
And you could die.
Exactly.
You could die from it. So
Definitely.
if you have any of those symptoms that Roger happened to mention, or you're at least just the smidgen of worry about that might be you,
Go talk to your
go to
doctor.
your doctor. Like now.
Exactly.
And that's
Exactly.
what they're there for.
Right away.
Don't be embarrassed. You know, that's what they're there for.
But you have to watch the end of the podcast first.
Yeah.
So no,
That's
I'm
true.
just kidding.
Not just that. Well, you need to go. You need to go.
Yeah, you gotta go, right?
That's right.
So Roger, again, thank you so much for being here.
Yes.
We're gonna send you a and stuff
Oh,
with Don
you-
and Mike t-shirt.
Very limited.
Oh,
Very, very
right.
But first, you have to answer a couple more questions.
At one,
Sure.
are you going to send us a tracksuit? No.
A what?
Are you going to send us? We'll send you a T-shirt if you send us a tracksuit. The suit.
Oh, a tracksuit.
I'm gonna edit that out. Don't worry.
I don't know.
We should have the cricket sound effects.
Yeah. So, okay, so the next topic, and I just want to briefly go touch on it. We don't know too much about it. It's diverticulitis.
Okay.
What is it? If you know any, if you had, I hope you didn't have that too. But I mean, if you have any type of experience with some of your patients that have had it in the past, what do they do? You know, kind of briefly, you know, just walk us through that.
Let us know what you know.
Sure. Yeah. Diverticulitis. Sometimes they interchange the terminology, and sometimes you would hear diverticulosis,
Yeah,
which is kind of very closely related. It's an inflammation of the large intestine. So what happens usually as we age, our large intestine is kind of like a muscle. So it's kind of like when we grow old, it's like we're old cars. You know, they get old. Our body parts get old. So what happens is after so many years, and if you're always constipated, it puts a lot of pressure on the large intestine for the stool to come out. So what happens? The large intestine develops these sacs, like kind of a blister on the sides of the intestine, and then it traps the stool in there. So that stool is not being expelled, and that causes toxins to stay with you. So a lot of people would feel like they're nauseated, they're vomiting, abdominal pain, and like I said, you're constipated, and it can lead to what they call irritable bowel syndrome.
IBS.
It's IBS. So, and then progressively it can, lead into maybe rectal cancer or these situations like diverticulitis is the lack of fiber in your foods. So those people who eat a lot of pasta or bread or rice and not eating vegetables, which is one of the most important foods that you should eat is the vegetables. And if, American lifestyle, there's no vegetable mostly. It's mostly bread, pasta, and rice, and
All the good stuff.
all this carbohydrates, potatoes, and all the bad stuff that tastes good, And that's probably one of the reasons why cases like that happens, and that's also the main reason why we have cancer, not only diverticulosis, but all different kinds of cancer because of the food that we eat.
Mhm.
And God knows what kind of pesticides we also have in this food that we eat, the preservatives and all that. That's leading to cancer. They have found that out. Aside from the number one killer, which is smoking, the second one is the food we eat, which also leads to obesity. So, you become overweight, your belly goes bigger, you're heavy, you're saving all this fat inside your body, and then you're not releasing this energy. So all this stored fat, eventually will lead you into diabetes and hypertension, and it messes up your kidneys. See, the thing, all these fats, they cover your liver and messes up. They cover your pancreas. They cover everything because they can't store it anywhere else. So it's a lot, not only diverticulitis, but it's going to be all over the place.
Hmm.
So make sure you be aware of that. That's the main cause of this whole thing. And diverticulitis is just one small part of it.
So you eat your fruits and vegetables, take your vitamins.
Pardon me?
I say, so you take your vitamins, you eat your fruits and vegetables, say your prayers. And, you should
Well, see, the thing is with vitamins, okay, that's another thing. It's good to take vitamins, but it has no use if your liver cannot process all these things because it's surrounded by fat.
Mm.
The liver stores the fat, the excess fat that we eat. But if it's all surrounded by fat, it's not able to produce more bile for digestion. So if you don't digest the multivitamins that you're taking anyway. So there's really no point. Yeah.
So
I have a fat liver.
yeah.
Fat liver. You might also have diabetes.
Almost
So
pre-diabetes.
yep.
Well,
Yeah.
we're all
Those are so
pre-diabetic,
interrelated. They're very closely related to insulin resistant diabetes type 2.
Yeah, I'm working on getting rid of the fatty liver. I just quit smoking, so here's to that.
There you go. It's a
Way to
big
go.
step, man. Smoking is it'll mess you up.
I would gladly murder you both for a cigarette, but I don't want to.
So Roger,
Yeah.
last but not least, obviously when we all turn 50,
Yeah,
we make that walk of shame to the doctor. And that doctor is going to tell us, guess what, Mr. Mike?
I just had this discussion with my doctor too.
We are going to act like Star Trek, because we're going to circle around Uranus looking for Klingons.
Klingons.
And obviously they're going to go with a camera inside and check you out. Now I've had that done. I'm sure you've had that done.
Right.
I'm getting it done this month. The welcome, happy birthday. Here's a camera in your butt.
Yes.
I got that done. I guess they're going the whole hog, the whole thing. I guess there's two different kinds, right? Isn't there like a smaller version? Then there's like the whole journey through your intestine tract or something like that.
I think they're gonna do the whole thing. You're all the way through your smaller intestine and
I hope so.
see if everything is functioning well. No cyst or anything like that. Yeah.
I don't have any history of that kind of cancer in my family, but I want it checked out anyways. Although I do have a big giant box of powdered Go Lightly. So
there you go.
at some point this month, you know what I'm going to spend a day and a half doing. And it's not going to be going lightly. I'll tell you that.
I tell you, that's the hardest part of it, because once the procedure, you just sleep over it.
Yeah, they knock you out for the rest of it. I really don't care.
Yeah. And then you wake up and it's over.
Yeah. It was funny because the doctor asked me, "Hey, do you have sleep apnea?" And I kept wondering why. And then I remember that they're going to knock me out, so I'm going to be snorting like I don't have sleep apnea, but they're going to be snorting like a pig the whole time they're putting a camera in. Thank God I'm going to be unconscious. It's just going to be a mess.
Now, we are joking about this right now, but it is no joke.
Very serious, yeah.
So I would implore anybody that is at 50 years old or over, it's not a pleasant situation. I've had it done. Roger's had it done. You're about to have it done. I had it going down the throat and up the other way. And the only difference between those two scopes was the flavor.
Yeah, one's great. One's not.
So, so what are some of the things that they could find while they're looking?
Okay, they're probably looking for maybe tears in the intestine. I don't know much about leaky gut, but that's another problem where, you know, your gut is leaking and then to your body, and that creates a whole lot of problem. And the good thing about that, you know, what you can do with leaky gut is they found that food like onions and walnuts are just the two things that you can eat to prevent leaky gut. So they could
timey thing, doesn't it?
Yeah, homeopathic type thing.
No, I mean the leaky
gut.
What do you got, Bob?
Yeah, I got leaky gut.
I got that leaky gut.
There's a lot of cases like that. And they could maybe find a cyst. They found a couple of cysts that were close to my appendix. So if they see something like that, they will just get it off.
Yeah, they
take it off
right then and there, don't they? Like polyps.
Yeah.
They're talking about
and
polyps.
Then they did that with me. I had a couple of polyps, and then they removed them and they had them tested to make sure that they were non-cancerous and all that stuff.
Right.
It's
and
really,
in the worst case, it's cancer. They might find cancer.
right.
Yeah.
So
tumor or whatever.
It's a scary situation because, again, you don't know what's happening. You're going to be asleep during this process.
Yeah.
The doctors, at least my doctor, I'm sure your doctor, and I would imagine your doctor, they're so kind. If just ask them every question you can. You know, it's an unpleasant situation, but we all have to do it. I was as skittish as anybody else, but I mean, you have to do it.
I knew it was coming. I knew I'd have to get it done. So, and everyone I know that's my age or a little older has had it done already. So I'm lucky in the sense that I know people that have had it done. I don't stress about it. And then my mom was a nurse, so I know that doctors and nurses are people too. So they're in that room with you. They know what they're going through, and like you, Roger, you had to go through it. So most of the time, the people in the room with the procedures are sympathetic about it. You know, they don't want you to feel miserable. They know. So you don't have to be embarrassed. I'm not too proud to admit that you know, going to be colonoscopy.
Yep. And you know, once they give you that the medicine to put you to sleep, all you hear is, you know, it's just like you just go out, and the next thing you know, they wake you up, and
exactly.
You know,
anybody that's had a procedure before, like I know you've been knocked out before. I had a lithotripsy done, which is for kidney stones.
Right.
The only disheartening thing about it is not being knocked out, because when you're knocked out, you're knocked out. Those guys are professional at it. You're really knocked out. But it's waking up in a different room from where you started and not knowing how you got there. That's the only weird thing about being knocked out in the hospital. You don't know how you got to this room.
Exactly.
So, well, with that, I want to say thanks again to Roger.
Thank you, Roger.
You've been very, very informative. Great guy.
Handsome.
Love talking to you. And I want to have you back, because I'm sure there's other stuff that we would like to talk to you about, like diabetes.
Oh yeah, that's the big one.
Hypertension. Yeah. These are unpleasant things to talk about, but you know what? Sometimes people don't have anyone to talk to, and sometimes people, they don't have a doctor, or they're afraid to go to the doctor. So maybe by watching this, they'll see our buddy Roger say, well, you know, these are the symptoms, or this is what you should look for, and this, that, and the other thing, and they'll say, you know what? Roger's right. I've got to go and have it checked out.
And I like that. And you can never have too many shows like this about people telling people to do the right thing and go to a doctor. And you never know where the catalyst of that change is going to come from, right? It may be it's you, or maybe it's from somebody else's channel, or maybe it's, but at least it's out there. There's enough choices for people to just click on Roger's pretty face and then listen to his advice and get to the doctors.
So not only like we said before in past podcasts, not only do we have a good sense of humor, we like to joke around, we like to you know, just be cut ups, but we also want to be informative, and we want to be able to have you guys come to us. I want you to write to us at Don and stuff with Don and Mike at gmail.com.
Yeah.
And just, hey, if you have a question and you want to talk to Roger, drop us a line. I'll get a hold of Roger one way or another, and we'll have him back on. You know, I'd love to have you on once a month if possible, you know, depending upon your schedule and ours. But this has been really fun, really informative.
It has been, actually.
Yeah.
Thank you, Roger.
So thank you so much.
Thanks for having me.
Okay. And your t-shirt's on the way, buddy.
All right. Thank you. Appreciate that.
You're, like I said, a very limited number of t-shirts. So
yes.
It's a rare thing.
Yep.
All right.
All right, Raj. Well, you have a great day. Thanks for taking your time out for us.
Yeah, you too, guys. Bye-bye.
Right. Hey, fist bump.
Yeah. Huh?
Fist bump.
Yeah.
Yeah.
There you go.
See you later.
All right, man.
Bye-bye.
Bye-bye.